Hello everyone, welcome back to my channel. Today I'll be talking about tuberculosis, commonly known as TB. So TB is a bacterial infection which is caused by Mycobacterium tuberculosis, and it mainly affects lungs, but it can also affect other part of the body. Also it can spread to other parts of the body. So how does it spread? Right? So the most common mode of transmission is person to person, that is airborne transmission. So what happens here is when a person infected with TB coughs, sneezes, talks or laughs, he releases a tiny infected droplet into the air which remains in the air for certain hours, especially in a poorly ventilated area. And when another person inhales this droplet, the bacteria can enter the lung, causing infection in a normal person. Also, the transmission is more common in close, prolonged contact, such as within the family, at workplace, or in a crowded area. So, who are at the higher risk of getting TB infection? First one is people who are living with TB patients or people who are taking care of TB patients. Second one is people in crowded places with poor ventilation. Third one is healthcare workers who are exposed to TB patients. And fourth one is people with weakened immune system. So how to prevent the spread of TB, right? First one is early detection and treatment of TB patients. Second one is TB patients have to use mask whenever they go out in a crowded area or in public. Third one is make sure you live in a well ventilated area. Fourth one is always cover your mouth and nose whenever you sneeze or you cough. Now, what are the symptoms of tuberculosis? Well, the symptoms of tuberculosis can be very similar to that of other respiratory diseases, but there are some peculiar symptoms with which we can differentiate or with which we can suspect that the person might be having TB. So let's see these peculiar symptoms. Okay, first one is persistent cough which remains for more than or equal to 2 weeks. Second one is unexplained weight loss. Third one is night sweats. Even in a cool environment, the person sweats, especially at night. Fourth one is evening rise of temperature. So towards the evening, the person might feel feverish or he may get fever regularly, especially towards the evening. Fifth one is chest pain while coughing or breathing, and also there is breathing difficulty. Sixth one is fatigue or weakness, which is so severe that it affects his day-to-day activities. So what are the investigations which can be done when we suspect TB? First one is sputum culture. Second one is blood test. Third one is tuberculin skin test. Fourth one is imaging test. So if lungs are affected, we most commonly go for chest x-ray, or else even CT or MRI can be done whenever required. Next, about tuberculosis in India. India has the highest tuberculosis burden in the world. So let us know what are the causes of high TB burden in India. First one is overcrowding and poor ventilation. So TB spreads very easily in slums, prisons and congested areas. Second one is malnutrition and poor immunity. Third one is delayed diagnosis. Many cases remain undetected or unreported. Fourth one is socio-economic factors such as poverty or lack of awareness, lack of access to healthcare facilities can contribute to spread of TB. That's all for today's video. I hope this was useful and you got an overall idea about tuberculosis. If it was helpful, then do share it with your friends and family, and do remember to subscribe to my channel and start your journey on being healthy. If you have any doubts or any questions, leave it in the comment section below. Thanks for watching. I'll see you in the next video. Until then, goodbye.